Welcome back to the Relentless podcast. I am Sandra Weber. If this is your first time joining me, thank you so much for spending this time with me today. I am a massage and bodywork therapist by licensure. I've spent the past 10 years working with clients hands-on, in palpation, feeling their bodies through different seasons of life, different needs that they're coming to me for. And I'm hoping to be able to bring to you today a lot of great information about your body, but that also ties into your mental and emotional aspects of life. So that's what this podcast is for. If you are returning today to hear another episode, you'll notice something a little different, that it's only me. So this is going to be a solo podcast because I want to spend some time with you and really dive deep into why you hurt. What are some cofactors in physical pain? Because when I started my career in bodywork, I did it to help people heal, to help them learn about their body, and to be pain-free. In doing that, I learned very quickly that people were coming to me because of physical pain, but their physical pain was merely an expression of mental and emotional distress in many cases, if not a factor in every case. And we're going to dive into that. We're going to cover a lot of things about the mind-body connection with physical pain. I'm going to give you I have a stack of books here. If you're catching this on a different app and not YouTube, I hope that you'll go to YouTube, and because I'm going to have some visuals here for you, and it'll give you a little bit better idea of connecting the mind and body. But I have a stack of books that I'm going to go through. So this is going to be a lengthy podcast, so be patient. But I'm hoping to provide you with not just my opinion, but research, studies, authors, other books that I hope will interest you to take more of a deep dive yourself into why you're hurting. I'm going to give you some brief excerpts from those books that maybe will trigger, that sounds like me, or maybe I should look more into that because all of these other things I'm trying aren't working. So I'm going to read some of excerpts from those books. We're going to talk about tissue. We're going to talk about muscle. We're going to talk about a lot of things that will hopefully do for you what I intend this podcast to do, and my work to do is get us more associated with our mind-body connection. So physical, mental, emotional, and spiritual parts of our life, we too often disassociate them and try to take care of one at a time. But the goal in this podcast is to hopefully show you how deeply connected they all are, and that we have to take care of each component for the other to be healthy. So we're going to talk about massage. Obviously, that is my forte because that's what I do in my 9 to 5. That's where my expertise lies, and hopefully I can bring some more information to you about your body, because regardless of what your precursor was, you eventually going to start hurting physically. That's why people come to me, because they are hurting physically. If I had a nickel for every time I hurt, I carry my stress in my shoulders, I'd be rich. So whatever the precursor is to hurting, there's that physical element that we have to be addressing. So I will always be going back to that physical element and the expression thereof, how to help that be reduced. But we have to have the conversation about where that came from. So we're going to talk about massage, bodywork, what that looks like. If you've had experience with it before, if you haven't, diving into that. Why am I not getting better? Why am I continuing to hurt after this treatment, this expert, that expert, getting massage, trying this? Why am I not getting better? We're going to talk about that. We're going to talk about protocols of ice and heat, what should you do, foam rolling, all those good things. Emotional and stress, how in the world does that cause pain? Again, like I said, I'm take you through some books and give you some information. All of the things that I talk about outside of my opinion and experience, I will provide in the show notes. So please, the more you research about your body and how it is expressing itself, the more apt you are to get well. So all of the research will be in the show notes. Talk about stretching. We're going to try to hit it all so that you can get some type of understanding of why your body's doing what it's doing. Because and this is how I try to educate my clients. Number one, I can't make you better. I can't fix you. I nix that idea as soon as someone says those words. I cannot fix you. I can give you information. I can definitely make you feel better in a session with the bodywork theory and education that I have. But for you to get well over a long period of time, it comes down to what you're doing with your body. First of all, it's such a privilege to be a massage therapist and to be with my clients in that capacity when they are going through their healing journey, whether it be from past trauma, from a physical injury, whatever the reason is. When they choose to see a body worker, it's such a huge responsibility, I believe. And we need to make sure that you're seeking out properly trained therapists. When you are getting massage and bodywork, where you go will give you a better idea of your outcome. There are therapists in many locations, many facilities that are great and there with the right intentions, but your experience could be different in a lot of them. But for me personally, we call it holding space with our clients, and to be able to facilitate someone's healing and be in those moments is such an honor. And one of the authors that I have that I'll talk about more later, Bissell van der Kolk, talks about how massage is such an integrative part in connecting the mind and body. And one of his quotes that I love is, "The most important thing is to create an environment of safety and physiological calm in which healing can occur. It starts with feeling safe in your body." And he goes on to talk about massage, yoga, Tai Chi. You have to be doing something to tell your body it is safe in space and time. That is a huge part of healing and a big part of what is missing when people aren't healing the way they should, because our brains are often our worst enemy, and our thought processes tell our body that we need to be in that fight or flight mode. So if we can start to find avenues, massage being a great one of them, to tell our physical body it is safe, it is okay, it is being cared for, that's a huge avenue to start that journey into healing and recovery. A little bit about the bodywork side and some technical things and information there. People come into bodywork for many different reasons. You may have tried it in the past and said it just didn't work for me. You may have had a bad experience with a therapist. You may have walked away from a session worse off than you went in. And that's what I want to hope to cover a little bit here to begin with. So when you are seeking bodywork, number one, think of why you're going there. If it's just for a random birthday or girl's day or whatever, the stipulations for which you would look for a therapist may not be that important. But if you are looking for physical care and recovery for an injury, if you are looking for someone that can facilitate that space of calm and healing, they need to be trained. They need to have a background and history of training that can provide you the best care. So make sure you research the person you're dealing with. Especially with trauma, when you're trying to recover from emotional and other extensive issues and issues from the past, you can't walk into a 60-minute massage and expect your nervous system to just calm down and be ready to go to relax and get into that space, into that flow space, because it's going to take a while for your brain and body to reconnect. So if you've tried massage before trying to help yourself recover, and you've only done 60-minute sessions, that may be why. Most of my clients do 2-hour sessions because of the training that I have, the different techniques I can use, how I work through the body anatomically, and with craniosacral therapy, I have more, we call it tools in our tool belt of things to do that can help you. So if you have tried it in the past and it hasn't worked for you, I encourage you to venture out into other therapies, other practitioners, longer sessions, and get more benefit out of it. And I compare this to your job. Whatever your job may be, you have your specialty, and you know how long it takes to perform the task of your job to do it well. If you have someone that comes at you and says, I need it done during this time, I have a time crunch, I have to get it done, and what time you would normally take to do a very good job, you reduce that time frame down, you can still get the job completed, but you know you have to cut corners, you know it's not as good as it could have been, and they don't get the proper care given the time frame that you had. Same thing with a 60-minute session. And most facilities don't even do 60-minute sessions. They do 50. And then if you come in late because traffic was bad or you got lost or you feel the need to talk a lot and share your history, your minutes are reduced. The time on the body is extremely restricted. Next client's right thereafter. So just think about those things in the parameters of if bodywork has worked for you in the past or not. Draping, glute work, that's a huge question that I get. Your therapist should be trained on how to do proper glute work and use proper draping. Again, going back to facilities and industry standards, some facilities have a "we are not undraping the glutes" rule. So again, practitioner, their training, the facility, you have to look for the therapist that is adequately trained and has the ability to do what you need and in the right facility. So make those choices accordingly. So we're going to get into the actual physical body. Again, we're going to tie in the emotional, the mental, the trauma, how that plays out in the body. But we have to address, and right now, if you are going through that and that is the path that you're on, you know you're hurting physically. So we have to learn to help outside sometimes before the inside can get well. But in doing so, the inside can get well more quickly. So let's talk a little bit about what happens to the body and why it does hurt, and a couple of different reasons why it hurts. Because if you don't go after the right reason that is hurting, it won't not hurt anymore. So let's talk a little bit about why you hurt and how to correct that. So in my opinion, one of the biggest reasons that people have chronic pain, chronic physical pain in their joints is because of weakness. And a lot of practitioners don't like to use that word because it can be a nocebo. So we know placebo is a positive information and association of information in the brain. A nocebo effect is the same thing. Let me explain what a nocebo is and actually why some clients have suffered from this from other practitioners in the medical profession. So I had a client last year that came to me because she had frozen shoulder. If you have had frozen shoulder, you know how debilitating it is and how painful it is. So if you've had frozen shoulder, you know that you cannot raise your arm up above a certain level. It literally won't. It hurts too much. You can't do it. So this client came to me saying that she had frozen shoulder and wanting to get bodywork to help. Showed me that she couldn't raise her arm above that capacity, extreme pain. So I went into the intake, asking questions, health history, all that. She was getting body work, so doing massage, working on the back, things that I do. Midway through the massage, I have her slide down on the table and turn over to her back so I can work on the front of the body because that's, I know, where a lot of the issues lie. When she slid down and turned over, she had long hair. She flipped her head around, tied her hair up in a bow, tied it in a knot, and then put her arms back down. So I brought it to her attention. Do you realize what you just did? And she didn't have a thought about it. I said, you just fixed your hair, both hands above your head, got your little bow in place, tied it up, tucked it in, and it didn't hurt. And she was like, oh, wow. But there you go. So she was diagnosed with frozen shoulder because, as well-intended as many healthcare practitioners are, they don't have the skills to look at the body and properly test the body on muscle function. It's not their paradigm. They treat symptoms, and sometimes that's necessary. In her case, it also was an emotional tie. So in her history and over a course of time, I could tell that there was issues in her marriage and other things like that that definitely came into play. But she did not have frozen shoulder. But because she was told she had frozen shoulder, she began to behave like she had frozen shoulder, which will give you frozen shoulder. Because if you become immobile and you have the thought process, my body can't move, it can't do this, you'll stop doing that. And then those muscles will not be able to do that. So that's why it's so important and why it is sticky with some practitioners to use the word weakness. Your shoulder is too weak to move. But the fact of the matter is, if your muscle is unable to do retraction, if your muscles that hold you back and down are unable to do that because of lack of capacity and communication, then we have to address that. And that's what I see as a huge component in that physical joint pain. Is so many times you are going to see practitioners that focus on the site of pain. So I hurt here, so I get Braxton, I get dry needling, I get massage, I get myofascial release here, 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 and it gives you some relief for a little bit. But the weakness on the back of the shoulder with that forward slumped posture that we all have isn't addressed properly. So until that side of stability for your joint is addressed, you won't get relief from your pain, no matter how much medication you take, no matter what therapy you get. If the muscles around a joint aren't stabilized and properly functioning, you will continue with your pain. It will get worse. It will go to more joints. So the progression of instability, talk about that for just a moment. All of the muscles in a joint, muscles all have different jobs to move you up, down, back, forward, rotate. If they are not working correctly, you will begin to get dysfunctional movement, and that results in pain. So the first thing that will happen, and I'll just use the shoulder, but the same is for the hip, the knee, ankle, same in every joint, just different muscles. So we know pec minor and pecs are here, and we know that we all slouch because we're tired, over the steering wheel, over the phone, bad posture, sleeping habits, sleeping in that fetal position because it's so safe. So things that we do are creating restriction and tightness here, not breathing properly. That comes into the emotion and trauma and not speaking your truth, all the voice aspect. All of those things here are creating so much tension. We begin to create a habit that is asking the back of our body to elongate, to facilitate anterior flexion. So I'm going to try not to use too many big words, but I have to in some capacity. So scrunching forward. When that happens over a period of time and you want to reach your arm up to get something, the muscles that have been over lengthened for so long are no longer functioning well. Now, when you hear someone say you have your glutes not firing or your muscles are weak, like I said, obviously the muscles are still functioning. But to what capacity? How well are they able to do the action that they were designed for? Retraction, elevation. So when you're working with a practitioner, if they don't know this, if they don't understand how to look at those things, test certain muscles to the muscle that's hurting and correct that paradigm, you're not going to get stability of your joint. So the progression is weakness or downregulation in one muscle or a group of muscles. The brain senses that instability and asks other muscles around that joint to start working more. That is the natural method the body has to compensate. We've all heard compensation. So we begin to compensate, and that will last us for a while. That will work for a little while, but eventually it's not enough, and you go to reach for something really fast or do an overhead press or start a new workout routine and throw your arms up with momentum and a little bit of work from that compensating muscle. And eventually what happens is more muscles have to help. That's not enough. You start to get forced joint closure. So we start to get impingement of nerves and, rubbing of tendons. And that's where we start to get more and more damage, especially in the hip, that femur getting locked up into the pelvis, does all kinds of damage and pain because of the joint not being stable. So for whatever reason that got you to the point of pain, we'll talk about how that happened. Whatever the reason is, we have to address the issue of stability. So if you are, working on trauma history, working on emotional recovery and health, but you have these physical expressions of pain, we have to spend time, and you have to spend time and energy stabilizing the joint and getting the joint and the tissue and the muscle healthy. So we're going to talk a little bit about specifics of tissue health and muscle health and what that looks like as a practitioner, and how it has gone wrong for you in the past, and perhaps why you've walked away from a massage session or a physical therapy session or a PT session or working with a personal trainer and come out worse than when you started. So the first thing I wanted to, and this is why I'm using visuals, because some people are visual. So I have 2 balls of Play-Doh. They look the same except for just a little bit different color shade of green. But I want you to hear something. So this is the microphone. That's one ball of Play-Doh. Here's the other one. I'm hitting the microphone again. tapping it again with my fingernail. Nothing. Looks the same, feels completely different. This has been left out for about 2 months. It's dry, it's lighter, less dense, less tone. Those are the words in the massage world we use. This feels completely different. It feels like more weight, more full, more tone, more density in this. This would be a comparison of unhealthy muscle and tissue versus healthy muscle and tissue. Dry, ischemic, lack of blood flow, lack of lymph flow. Healthy, has nutrients, blood flow, nutrients going to it, healthy tissue. This is a huge paradigm shift in your practitioner care, whether they understand this paradigm or not. If you are coming to me because your shoulder hurts or your hip hurts, and all of the muscle and tissue around that joint feels like this, I have no business being in there, hammering you with my elbow, doing all types of decompression to this type of tissue. And that's the problem, is that with certain practitioners, you're trying to recover from pain. They have 5, 10, 15 minutes with you. They're going to shoot for the place that you hurt. They may be decompressing muscle and tissue that does not need decompression or treatment. So let's talk about how that differentiation happens. How does some tissue get healthy and stay healthy and other isn't healthy, and why you still hurt in an area where you shouldn't get decompression? So when we talk about the examples of healthy tissue, we're going to talk about hypertonic, like a hyperactive kid, overactive kid. Hypertonic tissue and muscle is definitely an issue, and it is indicative of an area of the body that is the compensator. It may be that go-to spot that you hammer on, for example, the hamstrings. The piriformis, I'm sure you've heard about that, in the glutes. And this, again, this little tiny example of a muscle, super hard, hypertonic, overtoned, overworking. Could be the forearms. It could be the calf. That's a big popular place. People are foam rolling all day long. And you may have this piriformis or one of the other external hip rotators, guys, with your feet pointing out, rolling that pelvis under in that guy stance. You may have one of these muscles in there, and that truly is an issue. The problem is the other big tissue on top of it, your glute max, looks like this guy. Just thin, no tone, no structure, no density. And that's what's laying here. That's what could be laying here. Hamstrings could even be weak. And all of the muscles of this posterior chain are downregulated, not functioning properly. So something has to take over. It may be the piriformis. It may be QL. One of those other muscles maybe have been working so long for you that it now has become this hard hypertonic muscle, and you keep beating it up with a foam roller, with a Theragun. You keep getting it dry needled. You keep getting it worked on. But if you work on just this one muscle and it gets downregulated, lengthened, and you walk out of the office, what is now holding stability for that joint? Either that muscle has to hypertonically contract quick, fast, and in a hurry, or another muscle or joint has to start locking down because your body needs stability. That's why your back gets locked up. That's why you bent over to get something and you got stuck. You couldn't move because your body knew it didn't have the muscle capacity to bring you back up to hold you stable. So when your therapist is working on your body, they have to be aware of this and trained in that capacity of palpation, or they're making the situation worse. So if you have been getting treatment and care and it's not getting better, and it's actually getting worse, that may be a factor. And tissue can also be, so this is an example of that, that thin, unhealthy tissue that has no tone, and it has a certain feel to it in palpation, but at the same time, it could be even worse, and it could be like this. It could be that thin, low-tone tissue, but dry and hard because it is so ischemic. It is so lacking in nutrients and health and blood flow that it feels like a piece of hard Play-Doh on top of a bone. And so again, you're coming to me because you hurt, and I'm going to deduce from palpation skills and muscle testing and watching you move that's not the problem. That's the result of something else. So we have a saying in the industry, low tone, leave it alone. and we find those hypertonic areas, the compensating areas, work those, and then activate and get the neural input of the muscle function of the other areas that are weak or downregulated back to a more functional capacity. So I'm going to hit this again. I'm going to keep going back to this. Whatever the reason is you got to pain, whether it be emotional trauma, mental issues, your body presents itself to pain. You come to me because you hurt. I'm going to address the physical, and that is part of this, but we have to start talking about the other parts that got you there. So just be aware when you're getting body, if you're looking for body work, if you're going into that space to try to help with healing, make sure your practitioner is trained in how to be able to see that. And there's 1,000 different certification courses that we go through. So many of them are good. It's a journey. You have to find the right one, get referrals, look at their history, look at their training, and get the best body work and the physical care that you can get to help you on your journey of wellness. So that is one reason why we are not healing from physical pain, is the overall stability not being achieved for the joint, and you can't get healthy. And then with that same thing with getting overworked in a physical capacity with care, we can be overstretching. It's the same idea. If you're constantly stretching a certain muscle and not getting results with it, or you feel the need to always be stretching that area to get some kind of relief, why does your brain immediately go back to that area to tighten it back up? You have to get that stability. And over-medicating. If you're over-medicating to get relief from an area constantly, I have to take Tylenol or whatever it is every day to get relief from this. If you're not getting stability in that joint, you won't find full recovery and healing. Now, the main reason we are not recovering and getting well, the main reason is one that is frustrating for me because I see this in my office every week. I can say that with conviction because I know it is true. People come into my office after they have seen some great practitioners, some great surgeons, some great neurologists, and they know their stuff in that one category. What they don't have the ability to do, or the knowledge of how to do, or the time really is what it comes down to, because how many minutes do they get with you till they have to get to the next practitioner? The reason why most people aren't getting well or recovering from pain is because no one is asking why. Why is your muscle this way? And how did it get that way? That's the biggest reason why people are not getting better. It's not because our practitioners aren't well-intended. It's not because a lot of my clients aren't putting in the work, because they are putting in the work. They're doing the homework that other practitioners have given them. They're doing all the right things with their diet. But if we don't ask why your muscles or body or gut or whatever got the way it is presenting, you can't undo that reason to help it not continue to seek that same external stability. So, how and why? That's our next topic. First, obviously, with me, anatomical. So when someone comes to me, I'm looking for anatomical reasons, anatomical things from their environment that is creating a posture, that's creating a movement pattern. So what are the anatomical functional issues you may have? And it may just be that with some people. I've had a lot of my clients are dentists, surgeons, and myself included. Their job forces them to be in this overreaching position every day. Desk job, that's an easy one to pick out. If you have a desk job, you're sitting for so long every day. You're sitting on your rear end, your glute max, and down regulating it. You're putting constant static pressure on it all day long. And constant static pressure is a method I use to decompress a hypertonic muscle. So it may be just an anatomical, functional, repetitive issue that got you to where you are. It could have been a fall, injury, repetitive injury, your sport, a desk job, traveling for work, nurses standing up all day. So again, you can see, okay, it could just be a habit. It could be how I'm using my body on a daily basis that is contributing to my pain pattern. You can't not go to work tomorrow. So if you have to do that thing that is constantly calling your body into a dysfunctional pattern, you have to intentionally spend time every day, every other day, undoing that pattern. So I have on my YouTube channel many other videos that help, especially with that stooped forward posture, to undo that. The simple concept is opening the front, activating and strengthening the back. And there's simple things you can include in your daily routine to help facilitate stability by addressing anterior flexion, posterior over lengthening, and keep that balanced. If it's just a functional issue, if that's what it is, awesome. You should find relief very quickly, and you should be able to recover and maintain on your own, and then get your massage or your whatever as you need to help kind of just boost the body and calm the body in many different ways. The next issue of why and how your body got the way it is and why it's presenting in pain could be an internal health issue. So lymphatic system, lymph blockage. The lymph is the sewage system of the body. It's what cleans out all the bad things. If you are watching this right now, I want you to pause, and I want you to go over to any other social platform and find Dr. Perry Nicholson, my very good friend and colleague and mentor, and follow him on all the socials. He is just all things lymphatic, and will give you a lot of information, has a lot of videos, movement techniques that help you get your lymph moving. And one of his quotes that I love is, "No system ever works alone, never gets injured alone, and never heals alone. Don't name and blame, think and link." And again, that's one of the huge downfalls in your care that you're receiving, is no one is linking anything together. So if you come to me for hip pain, and I can see that it's not a functional contribution that's come there, and if I place my fingers right inside your hip bone, and if you're not getting anterior front of the body work, you need to find another practitioner, because this is where you need a lot of body work done. But if I am working your hip and trying to find those places of the body where the muscles are compensating and need decompression, and I barely touch inside that hip bone, the front of the hip bone up high, and it brings you off the table, that is not your psoas. Psoas gets bad rap. A lot of people have a very weak psoas and weak core. But when I touch you, if I barely touch into the front side of that hip and it sends you off the table because it hurts so much, immediate red flag that there is internal organ lymphatic issues that are contributing to your hip pain. So if you're constantly going to get massage on your glutes and your hamstrings because you're trying to help your hip, but you have a history of medical interventions, drugs that you've had to use for certain things, and it was necessary, not saying it wasn't, but you have a lymphatic problem and your sewage system of your body isn't working well, that lymph system gets backed up, that in and of itself can be the reason you have hip pain. So if no one ever asks that question, or if no one ever touches the front side of your hip around the different organs of the body and find that tenderness, because healthy tissue doesn't hurt to be palpated. Healthy tissue doesn't hurt to be touched, poked, squeezed, of course, to a certain capacity, but it doesn't hurt to be palpated. If it does right away, then that is indicative of there is an internal problem. So let's dive into that internal problem. So what are the things that could cause issues with our organs, issues with our lymphatic system? And this is going to be a topic that a lot of people don't want to address. But if you are on that journey to be pain-free, and you are trying to not hurt, and you're trying to be as work in a capacity, the highest capacity that you can, you have to start asking these hard questions and asking, what else is contributory to my pain? It may not be just functional and anatomical. It may not be just me sitting at the desk. So what else could be causing my internal organ and lymph issues, resulting in musculoskeletal nerve pain? Nutrition deficiencies. Again, I will have all of this posted in the show notes so you can go do your own research. So bear with me. I'm going to walk through several different nutrition deficiencies that are linked to pain. So again, if you don't know this, how can you course correct? You can get a massage every day for the rest of your life. But if you don't address these deficiencies, you will still be in pain every day for the rest of your life. So let's make a change there. So this is the Integrative Pain Science Institute, and I'll give you their information you can follow after and get all this to look up for yourself. Would it surprise you to know that poor nutrition can be the cause of your pain? The standard American diet causes numerous nutrient deficiencies, which has implications for chronic disease, including pain. So we have to start working hand in hand, bodywork, PT, all of those things with your internal health. We know this. None of this is rocket science, but you have to start taking ownership of your internal health. Over time, metabolic processes break down, leading to a variety of pain-related illnesses, including musculoskeletal pain. According to a study published in the American Journal of Clinical Nutrition, the average medical student receives just 23 hours of nutrition instruction. With 4 years minimum spent in medical school, a mere 23 hours on the topic of nutrition is alarming. So yes, your practitioners you're seeing are well-intended, but if they don't understand the questions to ask, you can't get well. So you have to start venturing out to different practitioners and different thought processes to get well. First thing we're going to talk about is vitamin D. Most American adults are deficient in vitamin D, which contributes to pro-inflammatory state because it inhibits calcium absorption into the bone and can cause musculoskeletal pain. Vitamin D deficiencies are common in patients with chronic pain, and deficiency symptoms can include fatigue and muscle aches. So if you're not getting the vitamin D, you can't absorb the calcium supplement that you're taking. Are you vitamin D deficient? Vitamin B. B vitamins are important for myelin sheath, which protects your nerves. B2, B6 can help improve carpal tunnel syndrome. B3 relieves osteoarthritis discomfort and resulting in improved joint flexibility, reduced inflammation, and a reduction in the need for anti-inflammatory medications. Vitamin B12 can relieve the neurological pain that presents with tingling and other strange sensations. It's a good clinical term, strange sensations. Vitamin B is available in whole foods such as meat, fish, dairy, dark leafy greens, almonds, peanuts, mushrooms, avocados, beans, and eggs. How is your vitamin B intake? Vitamin E. Vitamin E is an antioxidant, anti-inflammatory, and analgesic, and it has a long history of use for musculoskeletal pain relief. I can give you massage once a month or 2 times a year, but you can be in control of your vitamin E every day. Find vitamin E in sunflower seeds, almonds, spinach, red peppers, asparagus, fish, mangoes, and avocados. Magnesium. It's a popular one. You start researching. A lot of people know about magnesium. It's the most abundant mineral in the body. It is used for over 300 biochemical reactions, yet most Americans are deficient. It's required for protein synthesis, muscle and nerve function, energy production, blood pressure regulation. It is a cofactor for ATP, therefore vital for energy production. Magnesium activates vitamin D, which is also important for calcium regulation and bone health. Starting to connect the dots? The older we get, magnesium intake decreases. We see more deficiency symptoms, numbness, muscle cramps, abnormal heart rhythms are some of the symptoms seen in inadequate magnesium levels. The mineral is used to treat migraine headaches and may also be useful in treating fibromyalgia and impaired mitochondrial function. Dark leafy greens, nuts, seeds, fish, beans, whole grains, avocados, bananas are rich in this mineral. Amino acids are the building blocks of protein and are a large component of neurotransmitters, muscles, cells, cartilage, bone, and tissue. For anyone recovering from injury or surgery, or for those desiring muscle growth, proper amino acid intake is critical. So if you know you have a surgery coming up, better make sure that we have the proper amino acids. Adults require between 50 and 30 milligrams of amino acids per day. The foods that you can get that from are lean meat, poultry, seafood, eggs, chia seeds, sunflower seeds, almonds, avocados, figs, and quinoa. Next one, omega-3 fatty acids. So we hear these buzzwords, But again, if you are not researching your own, you don't know if that could be the problem. So stay with me. Omega-3 fatty acids, EPA, DHA, help reduce inflammation in musculoskeletal and autoimmune conditions, relieving chronic pain. I hope you're getting this. They stimulate the development of cartilage for joint repair, increase mineral absorption, and have been effective for treating migraines, back pain, and arthritis. If you are not craving the familiar sources like halibut, salmon, sardines, be sure you include eggs, walnuts, cauliflower in your diet. Calcium, another popular one. Be cautious of the way you're getting your calcium. Some of it is very inflammatory with a lot of antibiotics and other things in it. Cow's milk. Calcium is important for muscle and nerve function. Calcium is important for maintaining strong bones and controlling muscle and nerve function. Signs of severely low calcium include fatigue, muscle cramps, and abnormal heart rhythms. So if you're going to practitioners because you have an abnormal heart rhythm, if they aren't trained in dietary intervention, you may never get well and get a ton worse because they will only give you medication to treat a symptom. How's your calcium? The ramifications of long-term medication usage are that they can cause nutrient depletion, leading to widespread effects throughout the body. Nutrient depletions affect the immune, musculoskeletal, digestive, endocrine, and neurological systems, in turn causing pain. So now I've talked about nutrition deficiencies, but what else could be contributing to your nutrient deficiencies? Medication. Now, side note, myself and most of the practitioners that I work with, collaborate with, refer to are not Western medicine is bad, only holistic or alternative care is good. That is not how we think. It's not logical to think that way. Our emergency acute care is miraculous. It is life-saving, but it has its weaknesses. It's not either or, it's which one when. When are you going to use it and for what? That's how you will get overall care. Western medicine is amazing for acute and emergency care. They are very lacking in wellness preventative care and seeing on the paradigm of health and wellness where you are to prevent disease. They are regulators and treatment of symptoms, which is great. And you may need that at some point. Probably. I have as well. I've had 3 surgeries and 2 kids. Obviously, big proponent of Western and traditional medical care. But on the paradigm of wellness, they can't help you until you get diseased, until you have a certain amount of symptoms or diagnosable information, until I can see it on a scan or in a blood test. But you have this whole other range of health where other practitioners can see deficiencies in all these areas and be able to keep you from getting to the point of dis-ease. That's why you have to start educating yourself if it's just you doing your own education and research. But I highly suggest you get with practitioners that can do this for you because you will save time, and time is the most important friend when you're searching for these ways to help you get pain-free. So we're going to have to talk about medication. Is medication and pain assistance necessary? 100%, absolutely. Never would deny that. But we have to be aware and acknowledge when it becomes an issue that's adding to the problem or preventing you from the ability to get well. So here are common medications and their effects in the body and how they could be contributing to your internal gut health that result in the reason you're coming to see me for bodywork and contributing to your emotional and mental decline. Because when you are hurting, you're not thinking well. You cannot regulate your emotions when you are in physical pain. The only way to resolve the physical pain is find out how and why. Non-steroidal anti-inflammatory drugs and anti-inflammatories, NSAIDs, Advil, Aleve, Excedrin. This class of medication will deplete vitamin B, folic acid. It will deplete vitamin C. NSAIDs will deplete zinc, leading to a weak immune system, anemia, and increased susceptibility to infections. I can't think of another time in history, in March and April of 2020, when this is so important. There are things you are putting in your body that are depleting you of zinc. So we have to be aware of that and start monitoring what we're putting in our body. Steroids like prednisone and cortisone can deplete a multitude of vitamins and minerals such as magnesium, potassium, sodium, selenium, and zinc. So steroids deplete zinc, which are important for bone and cellular health, muscle and nerve function, and immunity. Another consequence is reduced calcium absorption, which interferes with both magnesium and vitamin D metabolism. So I'm not ever saying don't use a steroid. But if you are, I tell my clients all the time, if you feel you have to, fine. But at that time, you got to really hone in on making sure you are keeping the other levels of these vitamins and minerals tip top. So that's my opinion on that. Disease-modifying anti-rheumatic drugs deplete B3, B6, B9, B12, vitamin K, calcium, copper, iron, magnesium, and important other antioxidant glutathione. Opioids, codeine, hydrocodone, Vicodin, oxycodone, morphine, selenium, and glutathione, both important antioxidants, become depleted, as does zinc, which again is important for the immune system. PPIs, Prevacid, Prilosec, Protonix, they can affect a whole list of nutrients that include calcium, chromium, folic acid, iron, B vitamins, vitamin C, and zinc. The cascade of consequences from all these nutrient depletions can include changes in bone health, immune system, digestive function, and mental health status. So I hope you're seeing there's not a one size fits all. It's not, I can just take this and be okay. You have to add them all up. And that's what practitioners like myself do, is look at your whole health history, not just what you're presenting with today. Last thing on contribution of medicine to pain, ruptured tendons, Achilles tendon ruptures. Drug-induced tendon disorders are an often underestimated risk factor. They range from detrimental effects on the tendon, including tendinopathy, as well as potentially tendon rupture. 4 main drug classes have been reported to be associated with potentially deterioration of the tendon properties: corticosteroids, condyline antibiotics, aromatase inhibitors, statins as HMG-CoA. Most often, the Achilles tendon is affected in terms of tendinopathy and or subsequent tendon rupture. However, nearly every tendon of the entire body might be affected in a detrimental way by one or a combination of the aforementioned agents. So if you're coming to me because you have shoulder impingement and tendon pain or tendon rupture and trying to recover from that and asking me for myoskeletal work, obviously I'm going to work on the area and try to bring it relief, fresh blood flow, more range of motion. But if something you're constantly taking into your body, which most of the time can be regulated through lifestyle choices, that is the part of the journey you have to go on. So we have to look at, is it anatomical and functional? Is that the only contribution to my pain? Or is it something on my internal processes and functions that is not well because of something I'm depleted in, nutrient and mineral wise, or that I'm taking that is depleting the nutrients and minerals and rendering any supplements that I take of no effect because they can't help. All right, so now we're going to switch our process over from what we're taking into our body and what's been done to our body. So again, if you're on this journey of mental health, emotional well-being, freeing yourself from chronic pain, why and how, we have to go back to why and how you got there to start reversing that domino effect and creating a positive domino effect towards health. So this first book that I'm going to present to you is The Brain That Changes Itself. Amazing book. So in this, and the reason I'm sharing a lot of these books is because I hope that maybe they will get you interested in learning more, but also to give specific stories and case studies that you may have gone through, because we end up with pain and emotional distress because of something that the practitioners don't even see as connected to what we're dealing with right now. So in this situation, this lady had a hysterectomy, and this book is full of what they call miraculous healing, but it's not always as a miracle, yes, but it really came to play that they found the right thing that worked to help them get well. And that's another quote that I have that I love is, if your doctor or practitioner hasn't found what's wrong with you, it's because they're not smart enough. They're not looking in the right place. And you need to be with practitioners that will continue to search and continue to investigate and continue to ask questions to help you get well. So this lady had a hysterectomy at 39 and got a post-operative infection. Ladies, how many times has that happened? A lot. And was given the antibiotic gentamicin. It is known to poison the inner ear structures, can be responsible for hearing loss, ringing in the ears, and cause devastation to the balance system. They call people that have this side effect with this antibiotic wobblers, because they begin to lose their vestibular system. This lady, and this whole story is amazing. She couldn't stand up anymore. She couldn't go anywhere, do anything. And they did all the tests. They did all the, I hear so much, I've had all these tests and everything's fine. And they just, after they found out this is what it was, they told her that she had lost all vestibular function down to 2% of the function. It's permanent. And it was just going to be that way. There's nothing they could do. It's irreversible. Lucky for her, she kept going and kept searching and kept looking for practitioners that could help her at least find relief. But in her case, she got cure of her wobbling. So they did some treatment and different types of therapy with her tongue, and were working with the nerve endings of her tongue that in some capacity was able to rewire her brain, and she began to walk again. And at first it was just a few minutes, then it became a few hours. Over time, it did keep up. Over the next year, she wore a device more frequently to get relief and build up her residual effect. Her residual effect progressed to multiple hours, to days, and then to 4 months. Now she does not use the device at all and no longer considers herself a wobbler. So this is an amazing book. If you are in pain, if you are in a situation where you feel hopeless, this book will help you find stories that you may even relate specifically to, that will show you it is possible. It is all. If you're on this side of the dirt, I always say, there's hope. There is methods, there are treatments, there are practitioners that can help you. So in her case, she had an effect from a surgery, and they took an antibiotic, had a severe reaction, and that was her story. So you have to look back of, if I have this pain, what has happened in my past, in the past few years, in the past 10 years, honestly, back to birth. Your birth experience could have started a trajectory of function that results in pain. So as your practitioner, they have to be looking back into your history. So if it wasn't anatomical, if it wasn't a previous surgery or injury, a misdiagnosis, I hear that all the time, people being misdiagnosed, mistreated, which can cause a cascading of events. If it wasn't that, then we move into a third category, the biopsychosocial influence resulting in pain. So what is biopsychosocial? Sounds like a great word, right? Split it up: biological, psychological, and social influences onto our body and our perception that cause us to react in a certain way. So this book is When the Body Says No. They're all my favorites. But this book is a game changer. If you are suffering from anything right now physically, and I have nothing to do with these people. They don't know who I am, so there's no kickbacks for any of this, but it's just information that I've searched for my clients because they're not getting the help they need. When the Body Says No. exploring the stress-disease connection. So what is the biopsychosocial connection and its relation to your shoulder pain or your hip pain or your disease or your gut health? No disease has a single cause. Even where significant risk can be identified, such as biological, hereditary, and some autoimmune diseases or smoking and lung cancer, these vulnerabilities do not exist in isolation. Personality also does not itself cause disease. One does not get cancer simply from repressing anger or ALS just from being too nice. A systems model recognizes that many processes and factors work together in formation of disease or in creation of health. We have demonstrated in this book a biopsychosocial model of medicine. According to the biopsychosocial view, individual biology reflects the history of a human organism in lifelong interaction with an environment, a perpetual interchange of energy in which psychological and social factors are as vital as physical ones. Healing is a phenomenon of finding balance and harmony. So you could do, like I was saying before, in this physical, mental, emotional concept that we have of our bodies, if you're just getting home runs in the physical capacity, but you're lacking in one of these others, going to be an issue. And we will discover more of that later. Knowledge and insight have the power to transform, and why insight is more helpful to people than advice. If we gain the ability to look into ourselves with honesty, compassion, and with unclouded vision, we can identify the ways we need to take care of ourselves. We can see the areas of self formerly hidden in the dark. If illness is seen as foreign and external, we may end up waging a war against ourselves. It's kind of the definition of an autoimmune disease, right? In order to heal, it is essential to gather the strength to think negatively. What? Yeah. Negative thinking is not a doleful, pessimistic view that is masquerades as realism. Rather, it is a willingness to consider what is not working, what is not in balance, what have I ignored, what is my body saying no to. Without these questions, the stresses responsible for our lack of balance will remain hidden. And I've seen and heard many other psychologists talk about when we're constantly walking our body into a toxic environment, whether that be a marriage, a friendship, or your job, your body will pick up with all the five senses that this is not safe for me. It is not healthy. But we logically force ourselves to continue to go back into that environment and often medicate to be able to do that. And that's where a lot of our issues with our body come from, is the internal is constantly giving you the hormonal and other reactive processes necessary to tell you this is not safe, but we keep doing it, resulting in chronic inflammation, chronic pain. So the biopsychosocial, we're going to keep going into that, because if your pain is not from a fall down the stairs or an injury or bad diet or other health-related surgeries and interventions, could it be from years of emotional abuse? Could it be from years of physical abuse? Could the way you're presenting your body into the world, because we know people that are shy and have a history of traumatic things, they carry their body differently. So I'll go back to what I do with people. So if you're coming to me because your shoulder hurts, but you have adopted a posture of protection for years and years and years, and you can't come out of that because you still don't feel safe, it doesn't matter how much I work on the front part of your shoulder. If your brain is still telling you to protect, your shoulder can't get better. Again, marrying the mental, physical, and emotional parts of ourselves is the only way to get well. Women that are ashamed of their body, post-pregnancy, post-C-section, having a traumatic delivery, all of those things play into the psychology of our body image and the parts of our brain that relay the health of our body image. So again, if you have a negative self-body image, it's not enough to tell yourself, love yourself, you're beautiful. You have to go back and find out where that started and deal with that. Girls that are young that develop early, girls that are young that don't develop as they are shown in society how they should look. They create a way of being with their body that down the road, and I see this a lot, especially in teenage girls, that will create pain and susceptibility to injury. So I could, my daughter's a volleyball player. I was a volleyball player. I've seen volleyball players that there's something going on in that family or in their life that even though they have an extremely athletic body because of genetics, they are holding their posture in a certain way that is making them more susceptible to injury, even as a healthy athlete. So why is your body holding itself the way it is? What are the external contributing factors that got you there? When we protect, we turn inward. The next book I'm going to show you is Mind Over Medicine. Any ladies dealing with OBGYN issues, read this book. Anyone that wants to see a story of how someone came out of that world because she was tired of dealing with clients on such a hands-off level. And in one story, she talked about 7 minutes with a client that was just about to tell her this traumatic thing that happened to her, sexually traumatic thing that she thought maybe she could help with. She was coming in the door, hand on the door, giving her questions, asking her what she needed, and she could see the blank look in her eyes and being forced to do surgeries that weren't necessary. And this is a lot about her journey out of that world and into good care. This is an amazing book. If you have any female issues, this is an amazing book. We all have something, right? But she says, contrary to what we previously believed, our genes are not fixed. The study of epigenetics proves that our genes are actually fluid, flexible, and highly influenced by our environment. And here's the best news. Just because you have a genetic predisposition for XYZ doesn't mean these genes will actually express themselves. External lifestyle triggers like nutrition, environment, exercise, positive or negative thoughts, emotions literally affect your DNA. So what truly runs in your family? Heart disease and diabetes, or donuts and sausage? Don't get offended, because my family was the same way. Country, just think about that country paradigm, biscuits and gravy for breakfast every day. We all have things we had to overcome and get better at. Does your family history include gratitude and appreciation, or belittlement and abuse? Change your thoughts, change your behaviors, change your behaviors, change your biochemistry. That's big. If we don't start walking that domino effect backwards, we can't truly heal. So what was the paradigm of your family? What were the messages that you were taught? Up till age 6 and 7 is when our parents basically are writing the blueprint on us of how we are going to interact with the world. What were the messages that you got? Were they of encouragement? Were they of oppression, that you had to perform at this certain level and be this certain kind of athlete and get these kind of grades? If you didn't, you weren't worthy. What was the message you got? Because we're always that young kid on the inside. No matter how much we heal and how much we overcome, we're going to have a default setting of what we were raised in. So what were those messages that you got? We, in my industry, often say that posture is caught, not taught. So you can have someone tell you, stand up straight, have good posture. But if what you saw growing up was a mother that was afraid, that lived in fear, that held her body in a position that was always protective, what do you think your default setting might be? So we have to start going back and asking, what is my story? What is my history? Because we can do all these other things, all these other treatments, and they're wonderful. Massage is great. But if you don't ask yourself why and how you got that way, you can't find the answer to true health and true wellness. Next book, The Biology of Belief. Another one of my absolute favorites. And all of these people are on YouTube. So if you don't want to go read, if it's not your thing, listen to one of their talks on the way to work. The more you put deposits into your bank account of health and wellness, the more information you have, even if you pick up a tidbit, the better you're going to be and the quicker you will get well. So this is a little bit long. Bear with me. Biology of belief. When it comes to sheer neurological processing abilities, the subconscious mind is more than 1,000,000 times more powerful than the conscious mind. If the desires of the conscious mind conflict with the programs of the subconscious mind, which mind do you think will win? You can repeat the positive affirmation that you are lovable over and over, or that your cancer tumor will shrink. But if as a child you repeatedly heard that you were worthless and sickly, those messages programmed in your subconscious mind will undermine your best conscious efforts to change your life. Remember how quickly your last New Year's resolution to eat less food fell by the wayside at the aroma of a baking turkey dissolved your resolve. I believe the greatest problem we face is that we think we are running our lives with the wishes, desires, and aspirations created by our conscious mind. When we struggle or fail to obtain our goals, we are generally led to conclude that we are victims of outside forces preventing us from reaching our destination. However, neuroscience has now established that the conscious mind runs the show at best 5% of the time. It turns out that the programs acquired by the subconscious mind shape 95% or more of our life experiences. Habit. So, since subconscious programs operate without the necessity of observation or control by the conscious mind, we are completely unaware that our subconscious minds are making our everyday decisions. Our lives are essentially a printout of our subconscious programs, behaviors that are fundamentally acquired from others, our parents, family, the community, before we were 6 years old. As psychologists recognize, a majority of these developmental programs are limiting and disempowering. We'll learn more about the origins of self-sabotaging subconscious programming in Chapter 7 in Conscious Parenting of this book. But for the moment, be aware that there is hope even for those of you who have used positive thinking and failed miserably. I think we've all been there. The profoundly important fact is that disempowering programs in the subconscious mind can be quickly rewritten using techniques such as hypnotherapy, affirmations, body-centered therapies, and a large number of new modalities collectively referred to as energy psychology. And he has a huge resource in his book and website. And again, like the other practitioners are talking about, you don't even have to rely on a therapist. You can do this yourself with the proper research and the proper mind-body associative behaviors. You have control over that. Do I refer out all the time? I have therapists that do different techniques and different modalities that I'm not licensed in and don't have the time to be licensed for. When I see a client come to me and their intake form is answers to my questions, but then an email that I have to flip up 5 pages because of their traumatic history, I'm obviously going to help them with their body. Craniosacral is going to be a huge part of my treatment plan, and I'm going to refer out to a mental health practitioner that can help them properly allocate what has created the presentation of their body in my office that day. Can you do that on your own? 100%. Do you need help? Ask for it. It's a big part of healing and recovery. Okay, so we have all this information of 3 different ways that we can come into an issue of chronic pain or disease. What do we do? More specifically, what do you do? What do you do? I hope you get that point. You can have the best practitioner, the most well-intended physician, the best protocol, treatment plan, best therapy getting done to you. But if you don't start doing, it won't hold. The relief that you're getting won't be sustainable. You have to be actively involved, especially when it comes to physical pain, no matter how it got there, in recovery and in teaching your body that it is safe, that it is in the space to heal. So what do you do? Now we're going to move into treatment plans, therapies, and how they can all work. Because like I said, whether if you're on this journey because of mental and emotional trauma, you still have the expression of physical pain you have to deal with. That's where I come in. So I'm going to present to you some of the things that clients have used over history that have helped them help the outside speed up the healing of the inside. Because if you hurt, again, it's hard to heal in these other areas. So one of the first questions I always get is, should I ice it? Do I need to leave ice on my shoulder? I've been icing my back. And so this is a argument in the industry, and my opinion, and backed by science, and the man that came up with rest, ice, compress, elevate has also changed his tune. If your practitioner is telling you to ice on a regular basis for care, they are not making the right decision, and they have not stayed up on education and science that has come out. Again, I will have all this information in the show notes. You can go look at it yourself. But the man that came up with the rest, ice, compress, elevate paradigm and treatment protocol for injury and pain mitigation has since retracted that whole philosophy, because it's proven on a cellular level to do more damage than good. And here is his quote. Ice has been a standard treatment for injuries and sore muscles because it helps to relieve pain caused by injured tissue. Coaches have used my RICE guideline for decades, but now it appears that both ice and complete rest may delay healing instead of helping. In a recent study, athletes were told to exercise so intensely that they developed severe muscle damage that caused extensive muscle soreness. Although cooling delayed swelling, it did not hasten recovery from this muscle damage. He goes on to explain that inflammation is actually the mechanism for healing damaged tissue. He says, when muscles and other tissues are damaged, your immunity sends the same inflammatory cells to the damaged tissue to promote healing. So inflammation is a natural response of the immune system for injury and instability. It's there to help. The response to both infection and tissue damage is the same. Inflammatory cells rush to the injured tissue to start the healing process. The inflammatory cells, called macrophages, release a hormone called insulin-like growth factor, IGF-1, into damaged tissues, which helps muscles and other injured parts to heal. However, applying ice to reduce swelling actually delays healing by preventing the body from releasing IGF-1. So no, don't ice it. And if you have a student athlete, a college athlete, educate them on this, because I guarantee you their coaches and their trainers are still stuck in this old mentality. So like, we don't always have it right. Bloodletting was a thing for a long time. And if you didn't do it, you were excommunicated from the health industry, from the health paradigm of being a health healer. So we have been wrong a lot. That's why it's called practicing medicine, as they say when they get it wrong. Ice is not the best method of healing from an injury or maintaining or helping yourself through chronic pain. Foam rolling is another thing. Foam rolling the IT band. I get this all the time. You are making the situation worse if you are foam rolling your IT band constantly. The IT band is a tendon. It cannot be lengthened. It is completely attached to the femur all the way down. What relief you think you're getting out of it? You're moving some tissue around. You're maybe getting some blood flow and getting a moment of relief. But if you're hammering on your IT band, you are creating more inflammation, possibly more scar tissue, and making the issue worse. Again, you have to go back to, why do I feel the need to hammer on this area? Why is it so tight? And it's usually the muscles that are around it that are the issue, creating the tension that you feel, resulting in knee pain and hip pain. So if you find that you feel the need to hammer on your IT band all the time, get with a practitioner that can muscle test you, watch you move, and figure out why the tension is there. Foam rolling the IT band is not a good idea. Foam rolling in general, when you use it, could be very helpful. It could be if you are a person that's in the gym regularly, have a high muscle tone, you're an athlete like my daughter, basically have like a thoroughbred's body and all your muscles are staying tight all the time because of use, be on the foam roller, use that thing, help it decompress you, because that's one of the problems athletes have is they are in a state of chronic restriction and tightness because they're constantly working out, they're constantly doing their sport, and they never get decompression. So for them, use that foam roller head to toe on everything you can get. For the typical person in my office, I see more of this tissue. And you hurt because your joints are getting compressed because your tissue and your muscle is like this. So foam rolling can be another thing that will be detrimental to you, as well as body work. If all of your tissue is like this or like this, then I'm going to tell you, I'll work on you in a capacity that is appropriate, but I'm not going to hammer on you. I do ashiatsu. If you don't know what that is, it's where I walk on some of my clients because they need that pressure. A lot of my weightlifters and and people that are in the gym and have that high muscle tone, they can take more pressure and they need it. Great. Have no problem with that. But more isn't always better. Better is better. So if you're getting deep tissue and you're not getting better and it actually makes you worse, got to ask why. Goes back to the practitioner's knowledge. Do they understand the health of the tissue and the muscle itself? Dry needling, all of those things. It doesn't matter what the therapy or style of work is. What is it doing? Why is it being used? And if it's being used on the right spot, what spot in the body, muscle, joint, tissue line is associated with that created the issue? Going back to the why and how you got that way. If those questions aren't asked, you will not get healing and pain dysregulation, pain cessation. So we have to ask why and how. Sauna. I'm going to harp on the sauna for a few minutes. Whatever you're dealing with, whatever position you find yourself in life, every human being breathing on this side of the dirt needs to be using the sauna on an absolute regular basis. It's one of those things that my husband and I have agreed to, that whatever we have in whatever stage of life we're in, if we have to make decisions on vacation or, eating out, whatever it is we have to get rid of, we are going to be in a place where we can use a sauna regularly because it is so unbelievably beneficial for all avenues of health and recovery. And the reason I came into this research is because I'm trying to find ways that my clients that are hurting so intensely they cannot work out, but they have an internal desire to do something to help themselves get better. One of my clients came to me because she had severe right leg pain, had seen all the specialists, the premier practitioner for the football team here in Charlotte, the Panthers, came to me, and her whole right leg was atrophied. No muscle tone, no muscle density, no muscle function, continuing to get all kinds of different treatment. In searching for her and my other clients that need this is how I came into the sauna research. So I'm going to give you a little bit of background and what the sauna can do for you. Because if you're hurting, this is a great tool to use to help you recover quicker and do something for your body while you're hurt. The sauna will reduce your chances of heart failure, cardiomyopathy, atherosclerosis, Parkinson's, Huntington's disease, muscle atrophy. That's a huge one. It reduces muscle atrophy, prevents muscle atrophy. So don't just lay around not doing anything or taking medication. Maybe you have to. This is something all you do is show up and sit down. It's amazing. And it gives you all these benefits. Reduces insulin sensitivity, improves learning and memory, increases longevity, has an antidepressant effect. So if you are dealing with mental health issues, you don't want to go do a new thing that's hard on your body right away. Sauna. Start using the sauna regularly. Make it part of your healthcare routine. Repairs DNA, increases FOXO3, which turns genes on that kill tumor cells. That's one of the reasons I use it regularly. I've had 3 surgeries for ovarian cyst, a borderline cancerous tumor that I was told would be a reason I would not have any more children, could possibly still have cancer in the future. So that, you better believe, knowing this is a reason I will constantly be in a sauna because I know it's helping me preventatively. I'm not going to wait until I have to have a hysterectomy or wait until I have another tumor or cancer to start to deal with it. I'm going to deal with it now. And that's where you have to get is preventative care. Helps your immune system fight viruses, bacteria, and cancer cells. Delays aging. Who doesn't want that? And it mimics, this is another amazing benefit, mimics moderate aerobic activity. So my athletes, my gym rats, my CrossFitters, that it's just in your blood to be at that level of performance. When you get hurt, because you will, you still have that desire to be doing something for your body, feeling it have that expression of pushing yourself, and feeling your blood pumping and sweating in a sauna obviously has all these other benefits, but it also psychologically will give you that confirmation that you're still doing something great for your body. So that's huge, because the psychology behind an injured athlete can further prolong their recovery. So having the ability to do something for your body during that recovery time is huge. Sauna guidelines, it's dose dependent. To get the most benefit, you must be in the sauna 4 to 7 times per week. Part of your protocol. Temperature must be 79 Celsius, 174 Fahrenheit, 20 minutes up to 30. Work your way up to it. Make sure you have water with you, take towels with you, make it to where it's a little more comfortable. I'm to the point where I don't need anything. 30 minutes goes by and I'm like, I don't want to get out. This is my quiet time. So make it to where you can get used to it. Cold pool plunge during is fine. Cold shower after, great. And rehydrate, obviously. Contraindications, no alcohol before, not great for the elderly. Make sure you check with your practitioner provider. And recent myocardial infarction are all contraindicated. And all that information will be in the show notes. So moving from the sauna, can't talk about it enough. You can buy them for your house now. Don't go on vacation this year. Buy yourself a sauna. Live longer and healthier. If you get nothing else out of this podcast, do that. So now we're going to move into one of my other favorite topics, which is another difficult one for people to work on. And one of the first things that people tell me they say is a problem in their life, and that is sleep. If you're not sleeping, you cannot heal in any capacity, physically, from pain, internally, with your gut, mentally, and emotionally. You can't heal if you don't sleep. So my next favorite book is Why We Sleep. Amazing book. If you are dealing with anything right now of what I just said, physical, mental, and emotional health, please read this book. It will change your life. So we're going to talk about the science behind lack of sleep for a little bit. And then I'm going to, again, give you actionable steps of what you can start doing tonight to help you get more sleep so that you can heal. Just saying, I just don't sleep good. That's normal for me. Not normal. Habitual and an accepted way that you are maneuvering through life, but it's not acceptable. And if you're on this journey, if you're seeking health and pain-free living, you have to address sleeping. You have to make it a priority. It's going to be a little bit long of a read, so stick with me again. Come back in segments if you have to. We're going to start talking about emotional irrationality because of lack of sleep. So if you're trying to not be explosive with your emotions and figure out your emotions, and you're looking at therapists and you're taking medication and you're telling yourself to calm down, that doesn't work if the internal mechanisms aren't there to do the job of the system that helps you regulate yourself. And that's what this is going to talk about in many different capacities, not just emotional. So the analysis of the brain scans revealed the largest effects I have measured in my research to date. A structure located in the left and right side of the brain called the amygdala, a key hotspot for triggering strong emotions such as anger and rage, and linked to the fight or flight response, show well over a 60% amplification in emotional reactivity in the participants who were sleep deprived. In contrast, the brain scans of those individuals who were given a full night's sleep had a controlled, more modest degree of reactivity in the amygdala, despite viewing the same images. It was as though without sleep, our brain reverts to a primitive pattern of uncontrolled reactivity. We produce unmetered, inappropriate emotional reactions and are unable to place events into a broader or considered context. This answer raised another question. Why were the emotion centers of the brain so excessively reactive without sleep? Further MRI studies using more refined analysis allowed us to identify the root cause. After a full night of sleep, the prefrontal cortex, the region of the brain that sits just above the eyeballs, is most developed in humans relative to other primates and is associated with rational, logical thought and decision making. Is strongly coupled to the amygdala, regulating this deep emotional brain center with inhibitory control. So I see a situation, let me think logically, it's not that bad, I can deal with it. With a full night of plentiful sleep, we have a balanced mix between our emotional gas pedal, the amygdala, and brake, the prefrontal cortex. Without sleep, however, the strong coupling between these two brain regions is lost. We cannot rein in our impulses. Too much emotional gas pedal, the amygdala, and not enough regulatory brake, the prefrontal cortex. Without the rational control given to us by each night in sleep, we are not on a neurological and hence emotional even keel. So if you're searching and you're trying and you're not sleeping, it's not possible. And this is his opinion of his previous association of sleep and health. I was once fond of saying, sleep is the third pillar of good health, alongside diet and exercise. I have since changed my tune. Sleep is more than a pillar. It is the foundation on which the other two sit. Take away the bedrock of sleep or weaken it just a little, and careful eating or physical exercise become less than effective. Again, back to that physical, mental, emotional way we see ourselves. You can have it down in the physical capacity, in the mind, in the intelligence and mindfulness capacity, and leave the sleep uncared for and non-intentional, all of them will become a problem. Progressively shorter sleep was associated with a 45% increased risk of developing and dying from coronary heart disease. So if you're trying to have a healthy heart, you have to sleep. If you were one of the individuals who were obtaining just 5 to 6 hours of sleep each night or less, you were 200 to 300% more likely to suffer calcification of your coronary arteries over the next 5 years relative to those individuals sleeping 7 to 8 hours. Huge health impact. Now we're going to talk about sleep loss and weight gain. So we're taking these things to help us not be hungry. We're exercising. We're doing intermittent fasting, which, again, not a problem. But the less you sleep, the more likely you are to eat. In addition, your body becomes unable to manage those calories effectively, especially the concentrations of sugar in your blood. Sugar is a dangerous thing in your diet, yes, but here I'm referring to that which is currently circulating in your bloodstream. Excessively high levels of blood sugar or glucose over weeks or years inflicts a surprising harm to the tissues and organs of your body, worsens your health, and shortens your lifespan. So if you have pain when I'm touching your body in a massage session, why? What's the factor? It could be your sleep, because regardless of what you're trying to do, your body's not able to heal, because sleep is the time that our body's programmed to heal. When your sleep becomes short, you will gain weight. It's a fact. Now let's talk about sleep loss and the reproductive system. I can't tell you how many times I see this on social media, people struggling with this. If you have hopes of reproductive success, fitness, prowess, you would do well to get a full night's sleep every night. Take a group of lean, healthy young males in their mid-20s and limit them to 5 hours of sleep for 1 week. Sample the hormone levels circulating in the blood of these tired participants, and you will find a marked drop in testosterone relative to their own baseline levels of testosterone when fully rested. The size of the hormonal blunting effect is so large that it effectively ages a man by 10 to 15 years in terms of testosterone virility. So you can supplement, you can work out as much as you want. If you are not sleeping, you are not going to be fully healthy and be able to do all the things that you're seeking and trying to accomplish. Now we're going to go into sleep loss in the immune system. Again, immune system, being able to recover from and come into contact with disease and viruses. Our immune system is greatly affected by sleep. Recall the last time you had a flu. Miserable, wasn't it? Runny nose, aching bones, sore throat, heavy cough, and a total lack of energy. You probably just wanted to curl up in bed and sleep, as well you should. Your body is trying to sleep itself well. An intimate and bidirectional association exists between your sleep and your immune system. Perhaps you are one of the responsible individuals who will get a flu shot each year, boosting your own resilience while adding strength to the immunity of the herd, your community. However, that flu shot is only effective if your body actually reacts to it by generating antibodies. A discovery in 2002 demonstrated that sleep profoundly impacts your response to a standard flu vaccine. In the study, healthy and young adults, were separated into two groups. One had their sleep restricted for 4 hours a night for 6 nights, and the other group was allowed 7.5 to 8.5 hours of time in bed each night. At the end of 6 days, everyone was given a flu shot. In the days afterward, researchers took blood samples to determine how effective these individuals were in generating an antibody response, determining whether or not the vaccination was a success. Those participants who obtained 7 to 9 hours sleep in the week before getting the flu shot generated a powerful antibody reaction, reflecting a robust, healthy immune system. In contrast, those in the sleep-restricted group produced less than 50% of the immune reaction their well-slept counterparts were able to mobilize. Similar consequences of too little sleep have since been reported for the hepatitis A and B vaccines. So again, regardless of all the things you could be doing you think that are going to keep you well, and external interventions that you are choosing to put into your life that you think are keeping you well, they can't even work if you're not sleeping. Period. It's, again, the research will be there in the show notes. So we know that to be a fact. Research has shown it. We have the tests and studies that prove it. What do we do about it? And that's what I see with my clients is they're told all of these things, but they're not told what to do about it. So I'm going to give you the gold standard for sleep. As I tell all my clients all the time, this is the gold standard. You don't have to do it all. Try one thing tonight. Try adding one thing to your routine that can help you better regulate your sleep patterns, and then start to add to it, and then add to that. So the gold standard for obtaining a good awake sleep cycle. The first thing you should do is pick the low-hanging fruit. So again, just like with the person that is weak and they need strength and stability, I'm not going to throw them in a very difficult workout program because they're going to fail and they're going to get hurt worse. So when you're trying to sleep better, what is something that's easy and the first thing you could think of that is impeding your sleep? Is it kids in the bed? You may have to make some changes in the family dynamics, maybe a family effort. Are there pets in your bed? Gonna have to get them out. Do you have a snoring spouse? Their habit and lack of health cannot trump your need for good sleep. They need to make their health a priority or get out. And I'm speaking from experience, and I'm not the snorer. But if someone else is preventing you from sleeping, that has to be dealt with. So first, pick the low-hanging fruit. What's preventing you from getting a good night's sleep? Start there. Next, when we're talking about your mental and emotional health and well-being and the nervous system and stress and anxiety and all those reasons people come to me to try to help them reduce their stress, we have to address the issue of stress, because you can't remove yourself from every stressful situation. You can't not go to work tomorrow. If you're in the midst of a relationship turmoil experience, you can't just walk away. So you can't, if you're operating at a high level of intensity with your nervous system and you're up here, like imagine a rung of a ladder and you're on rung 10, you can't expect your body to be at level 10 and jump down to level 1 and calm down and go to sleep. It's not going to happen. Your body doesn't work that way. So we have to learn how to regulate our own sleep and sleep train ourselves. We do it with our kids. We need to do it with ourselves because we're just big babies. We just get bigger. We don't really learn a whole lot more. We have to regulate ourselves. So if you're up here, if you're functioning at a very high stressful level, what can you do at the end of your day to start helping you walk down the rungs of that ladder to where your nervous system is ready for sleep? Because if you jump in bed here and try to make yourself go to sleep, it's going to be very irritating for your nervous system because it's not down here. And that's why you stay awake for 3, 4, 5, 6 hours. And by 6 a.m., you close your eyes for a little bit, but that's not sleep. And another thing he talks about in that sleep book is medicinal intervention and alcohol intervention is not regulating sleep. If it makes you sleepy, that's not sleep. So that is a conversation he has in that book and does very well with it. 2 hours before bed, we're going to start walking our way down that ladder and negotiating with our nervous system to allow it to be in a place where it desires to go to sleep. 2 hours before bed, dim the lights in the house. Reducing the amount of input you have in your visual cortex is telling your brain, do I need to be awake and go and do and be? Or there's less sunlight, there's less input into the eyes. I need to start calming down. So dim the lights around the house 2 hours before bedtime. No screen time 2 hours before bed. Again, it's going to be very hard for some of you, but if you are searching and striving and crying out for help, mental, emotional, physical pain, this is a huge contributing factor to getting sleep, which makes you be able to get healthy. If you have to leave your phone out of your room, the sleep studies in that book prove and will show you why looking at things on your phone, your iPad, even reading on your iPad, detrimental to the brain, detrimental to the immune function, detrimental to your sleep. So no screen time. Stop eating 2 hours before you go to bed. If you eat, what has to happen? Digestion. All the systems turn on. Body says go, do, be. So eating is a huge regulatory factor in that awake sleep cycle. So these are all habits you can start doing to negotiate with your body to start being ready to go into sleep. A cooler room is better. So lower the air, make it cooler in the house. It's better to sleep in a cooler room. Snuggle up under the covers if you have to, but it's better for your body to be in a cooler room. You will get better sleep, better rest. Pick a specific time to go to bed and a specific time to wake up. And during times of chaos and mayhem, and when you don't have a real schedule to follow, that may be difficult, but do it anyway. Set your time you want to go to bed, set the time you're going to wake up, and stick to it because, again, it helps you regulate that system, that circadian rhythm, to where if you start doing these other things and you're negotiating with your body and you're working your body towards sleep, it will start to regulate itself and become natural, and you'll desire to go to bed and you'll be sleepy. Naps can be an issue. If you're not sleeping well at night, you need to not nap. Just like a baby, when you're trying to cut those naps out because it's more detrimental than beneficial, keep going, keep moving, working on a project, doing something to keep yourself awake so that you can maintain that awake sleep cycle at the right time, going to bed and waking up. If you have no problem with going to bed and waking up at those times, then naps can be great. They can be hugely beneficial. Alcohol, avoid it. Sedation is not sleep. That's what he says in that book. Sedation does not equal and is not equal to sleep. Sedation by alcohol and that calming effect you think it may give you and also sleeping pills. And he talks a lot about the detrimental effect that long-term use of sleeping pills has. Those other systems, nutrient and minerals, completely depletes it and is bad for you. Create a bedtime playlist. So using music to help your body regulate. We know how it feels to walk into a room when our favorite song is playing, what it feels like in our body. So when we're functioning at the level up here of 10 of stress and anxiety, if we were to put on calm and relaxing music to go to sleep with, it's going to be aggravating to the system. It'll actually make things worse because your internal regulatory system is up here and you're playing music that's down here on this level. It will become an irritant. So create a music playlist that you play as you're doing all of these things to get ready for bed. The first 3 songs, higher, more beats per minute, more exciting, just more energy. The next 3 songs start to work their way down. The next 3 songs are even more calm. The next 3 songs are right before you go to sleep. And then you've communicated with your body through your auditory receptors. So we've worked on the visual with the light. Now we're going to work on the auditory with our sound and tell our body and communicate to our brain, which communicates to our body, oh, it's time to calm down. So these are things you can implement today that will help you start to sleep. So music is one way we can help ourselves down regulate our nervous system. So after implementing music, we need to implement some other method of communicating to our physical being that it's time to calm down and breathe. It could be 10 to 15 minutes of yoga, reading, meditation, whatever outlet you choose and you enjoy, do 10 to 15 minutes of it. 5 to 10 minutes of it, whatever you can do, and whatever it is that you enjoy, find some way to communicate to your physical being another rung of negotiation to calm down. You can't just jump in bed up here and expect to go to sleep. Body brushing. Body brushing is another technique and tool that my clients use on a regular basis, as I do as well. Helps the lymphatic system on so many levels, but one of the results that they have is they're sleeping through the night better because their lymphatic system is working better, which makes all the other systems of the body works better. So you can sleep better. So doing something tactile to your body also tells your body, I'm intentionally taking care of you. I'm doing something to help you. There's another great book called Surgery is the Greatest Placebo. Amazing book. People getting knee surgeries, not getting the surgery, getting the little incision, but they're coming out as good or better than the ones that got the surgery. And it's all because of standard of care. They're separating themselves from their life for a few moments. They're caring for themselves. So doing something to care for your body, and even doing it with your partner, doing these things together and doing things intentionally to help each other communicate a level of care that is hugely healing and beneficial. So body brushing is great. More videos of that on my YouTube channel. Abdominal massage. We talked about the organs a little bit. We haven't gone into much of how the immune system works, but in that fight or flight system works. When you are rushed into fight or flight and your body's saying, I need to fight or flee, the blood rushes from your visceral, from your gut to your arms and hands and legs so you can have the energy to move and go and flee. That is going to create a process and a habit of lack and deficiency in the gut. When it comes to C-section and body image and scar tissue, doing your own abdominal massage is hugely beneficial. Coming back into contact with yourself, showing yourself that you love your body, doing something for it. I can't explain how beneficial it is. Abdominal massage on yourself. And to do that, you can use oils, essential oils. And using essential oils, another good trick to do to train your body for sleep. We know when we walk into a house and there's food that's cooked only at Christmas or any other holiday that you find enjoyable, you smell that food and immediately you feel peaceful, you feel loved, you feel happy because of a smell. Same thing with the negative. If you smell the cologne of X that wasn't a good experience, you're going to immediately feel bad. So use an essential oil every night. If you're dealing with mental and emotional and physical struggles, use these patterns of behavior as deposits for good and training your body and mind. Use the same smell for 7 days in a row, 2 weeks in a row. Put a little bit beside your nose. You can put some on an eye mask. You can use that oil to massage your belly with, but continually using that same smell as soon as your brain takes that information in through the olfactory nerve process, then it's going to say, oh, this is time to sleep. So we're coming down another rung on that ladder, getting closer to where our body is comfortable going to sleep and relaxing. What you can listen to, binaural beats, guided meditations. There are many amazing free ones, and I'll have some on my YouTube channel as well. Guided meditations, sleep apps, having someone read to you on an app. Now, just be careful with that, because I tried that one time. I've tried all these things. Trust me, I do all of this stuff I'm talking about. But I did listen to Matthew McConaughey once for the bedtime story reading thing, and his voice did not make me feel sleepy. So cautiously and intentionally choose someone that will make you relax. If that's something that you like, you may not want to listen to anyone read words. Music may be better. So pick the music that is appropriate for your sleeping. So that's sleep. That's the gold standard. You start implementing all those for 7 days in a row. I would love to know your results. If you're not sleeping well, try those things and let me know how it works for you. And that is going to give you a huge boost in your healing mechanisms and your recovery from pain. So next, we're going to talk a little bit about exercise and a few other external interventions, because they are definitely beneficial. We know exercise is good for us. It's not, again, none of this is rocket science. It's just that we need to be able to know how to do it. And the more we know, the better we can do. So this book is The Brain's Way of Healing, another book chock full of pathology, disease that people overcame with the right care and the right standard of treatment. And this is just a study on Alzheimer's. In 2013, that pressing question about walking and Alzheimer's was answered. Walking was a key contributor to a very simple program that reduced the risk of dementia by a staggering 60%. If any drug could do that, it would be the most popular talked about treatment in medicine. The breakthrough study was done in the United Kingdom, and what they were looking for and what the results of the study showed, exercise was the most powerful contributor to decrease risk of both general and cognitive decline in dementia. Exercise, if you're on the search, if you're on this journey of health and well-being, you have to move. Again, whatever capacity you choose, and then add to it when you can. Do what your body says yes to. And this story is about a lady that had multiple surgeries, again, near and dear to my heart, for endometriosis and other health issues, several surgeries, meaning she is getting scar tissue on top of scar tissue on top of scar tissue. That's preaching to the choir. This is what I have dealt with for over 17 years, an issue that it relates to me. And that's why I like these books, because you will, if you're on a healing journey, you will find something in this book that you can relate to very specifically. But with this client, what she ended up doing that got her relief, because nothing else worked, she ended up using low light laser therapy. And that's what this whole book talks about, is her experience with laser therapy. And this practitioner, I was becoming convinced that lasers were rapidly healing all sorts of things that could not be healed: cartilage, badly torn tendons, ligaments, and muscles. So if you've had several abdominal surgeries in your past, but you're coming to me with hip pain, and I'm finding what the things I'm doing, they're just not quite working. Getting deeper into your health history, what type of surgery have you had? What type of scar tissue do you have? Then it's absolutely imperative you do your own abdominal massage, and I can teach you how to do scar tissue release. But laser therapy in this situation was one of the key factors that helped her stop having abdominal pain. So she had to do another form of therapy that got her the best results. And it's all about the journey. You have to keep looking and find the answer. And in this book, he goes into a lot more detail about light therapy for mental and emotional distress and disorders, and music therapy, other forms of healing that people found because they kept searching. So that's the key. Keep searching. And I have recently done a podcast with a music therapist that you have to listen to, especially if you have autism in your family. That guest was diagnosed in her 30s with autism, And music is a huge part of her healing journey. Meditation, yoga. When my clients ask me, should I try? My immediate answer is yes. Try all the things, because you don't know how your body is going to respond to that stimulation that may promote you and open the door to your own healing. Can we rely on external intervention for healing? No. Again, big picture, all of it. But keep looking at things, keep trying things that help your body calm down, that can set the pathway and the momentum forward for you to heal on all levels. Now, the last part is this social aspect of a contributing factor that can result in chronic pain, or a social aspect of a positive contributing factor that results in our health and well-being. And that's what we have to focus on. We all know the saying, we are the 5 people that we surround ourselves with. Just like our family, we know can be a negative influence, and our friends and our community, our network that we have around us can be a negative or positive influence for our overall health. If you keep walking yourself into a toxic environment with people that only are living in a non-growth, victimized view of the world, how can you expect to go anywhere else? So we're going to talk about reciprocal co-regulation. And basically, this encompasses everything of the body, the biopsychosocial, because they're all included in this theory. 2 classes of defensive strategies: mobilization associated with fighting and fleeing, and this is the polyvagal theory. A little bit of a difficult read, so go watch his YouTube videos. So 2 classes of defense strategies: mobilization associated with fighting or fleeing, and immobilization associated with hiding or feigning death. The neural regulation of the striated muscles of our face and head are neurophysiologically linked to the neural regulation of our heart. The face-heart connection provides humans and other mammals with an integrated social engagement system that detects and projects features of safety through facial expressions and vocalizations that are covariants of autonomic state. Within this model, how we look, how we listen, and vocalize conveys information on whether we are safe. Safe to approach, safe to be. You know, there's so much association of physical pain with how we are communicating with others in our daily life. Asthma is so closely associated with restricting our voice as a child, being in an oppressive environment, in a fearful environment, not saying anything, hiding it, not using those expressions of anger and fear appropriately because we couldn't, myself included, to down the road create disease and dysfunction. So we have to start again thinking what we are presenting with, how did it get there? So the reciprocal co-regulation is the proof positive that we need social interaction. When I am out and about and I see my friends and people that love me, their smile, their tone of voice, what they're saying to me is another means of communication that our brain has to have that tells me I am safe. I'm heard, I'm seen, and that recognition is a huge part of our healing. The lack thereof, secluding ourselves, isolating ourselves, gives us a deep dive into that mental and emotional warfare, because we need to see and hear and communicate that we are safe, we are accepted, we are loved. My last book, last one, The Body Keeps the Score, another favorite of mine. In talking about this biopsychosocial expression and understanding of our body in time and space, I think this is going to be a little bit longer of a read, so stick with me. Another really great one to see on YouTube, listen to on your commute. Our gut feelings signal what is safe, life-sustaining, or threatening, even if we cannot quite explain why we feel a particular way. Our sensory interior continuously sends subtle messages about the needs of our organism. Gut feelings also help us evaluate what is going on around us. They warn us that that guy who is approaching feels creepy, But they also convey that a room with Western exposure surrounded by daylilies make us feel serene. If you have a comfortable connection with your inner sensations, if you can trust them to give you accurate information, you will feel in charge of your body. You'll feel in charge of your feelings and yourself. However, traumatized people chronically feel unsafe inside their bodies. The past is alive in the form of gnawing interior discomfort. Their bodies are constantly bombarded by visceral warning signs, all the senses, and in an attempt to control these processes, they often become expert at ignoring their gut feelings and in numbing awareness of what is played on inside. They learn to hide from themselves. Disassociation. I see this almost weekly in my practice. It's one of the hard parts of getting body work. One of the amazing parts of getting body work is you get reassociated with yourself. The more people try to push away and ignore internal warning signs, the more likely they are to take over and leave them bewildered, confused, and ashamed. People who cannot comfortably notice what is going on inside become vulnerable to respond to any sensory shift, either by shutting down or going into panic. They develop a fear of fear itself. We know that panic symptoms are maintained largely because the individual develops a fear of the bodily sensations associated with panic attacks. The attack may be triggered by something he or she knows is irrational, but the fear of the sensation keeps them escalating into a full body emergency. Scared, stiff, frozen in fear, frozen shoulder. Starting to see connection? A physiological, biological expression of psychological interpretation and belief and perception. So scared, stiff, frozen in fear, collapsing and going numb, describe precisely what terror and trauma feel like. They are its visceral foundation. The experience of fear derives from primitive responses to threat where escape is thwarted in some way. People's lives will be held hostage to fear until the visceral experience changes. So then you're getting communication into your body. No matter what has happened, I'm safe right now today. The price for ignoring or distorting the body's messages is being unable to detect what is truly dangerous or harmful for you, and just as bad, what is safe or nourishing. Why you would be with friends that you know and love you, and you still feel dysregulated because those aren't being connected. Self-regulation depends on having a friendly relationship with your body. Without it, you have to rely on external regulation from medication, drugs like alcohol, constant reassurance, or compulsive compliance with others. He says, many of my patients respond to stress not by noticing and naming it, but by developing migraine headaches or asthma attacks. This client, a middle-aged nurse, told me she felt terrified and lonely as a child, unseen by her alcoholic parents. She dealt with this by becoming differential to everybody she depended on, including the therapist. Whenever her husband made an insensitive remark, she would come down with an asthma attack. Start to journal. See where your symptoms are coming from. By the time she noticed that she couldn't breathe, it was too late for an inhaler to be effective. She had to be taken to the emergency room. Suppressing our inner cries for help does not stop our stress hormones from mobilizing the body. Even though this client had learned to ignore her relationship problems and block out her physical distress signals, they still showed up in symptoms that demanded her attention. Her therapy focused on identifying the link between her physical sensations and her emotions, and I also enrolled her in a kickboxing program. She had no emergency room visits during the 3 years that she was his patient. So kickboxing as an answer to asthma and trauma, how would that help? Because you're tying back in the mind, the emotions, and the body, and you are gaining strength and courage to feel safe in this physical being. We have to marry all of those aspects. So my clients that are coming to me because they hurt physically, they may be coming to me because they have mental and emotional stress. We have to, if we want to be well, healthy, and pain-free, take the physical, mental, and emotional parts of ourselves and realize that we cannot separate them. You can't say, my mental and emotional aspects of my life, I know they're not where they should be, but I'm going to take that physical, I'm going to be religious to the gym. I'm going to make that my priority. At least I have that one okay. Or my physical body isn't where it should be. I'm going to be a master at my craft. I'm going to be the best in the business. I'm going to be a success in my job. The other things I'll work on later. It doesn't work that way. What we have to understand, and if you're watching this, you're seeing me crumble up 3 different balls of Play-Doh, which every parent hates, but always happens, into one. Once we come to the realization that we have to intentionally address and care for every part of our physical, mental, and emotional being, it is all one. You affect one, you affect the other. You become deficient in one, you become deficient in the other. Big picture. So I hope this podcast has helped you pick up on some avenue you can start working on today, because it's the work that you put in that will give you the most results and the more long-term care, success. So until next time, stay on that journey of mental, physical, and emotional well-being. Thanks.